Hey everybody, how you doing today? It's Dr. McDade from McDade Family Chiropractic here in Rochester, New York, and I wanted to thank you again for watching this short research review. Today we're going to review a case study that just was published in the Journal of Upper Cervical Chiropractic Research, November 18th, 2013. And as you can see in the paper, it is a resolution of tic disorder in an 8-year-old boy following the Grostic technique. So for all you non-chiropractors out there, the Grostic technique is a very gentle and very precise way of adjusting the first vertebrae of the neck to regain alignment between head, neck, and the rest of the body. And it has a very, very powerful effect on the central nervous system when you get those vertebrae between the head and neck aligned so that they are firing and nourishing the brain with its vital amount of energy and stimulation it needs to properly function. And when those vertebrae are misaligned, it can really, really start to affect the timing within the nervous system, as well as create a level of deficiency within the central nervous system as the brain's not getting stimulated the way it needs to be healthy. So tic disorders. Tic disorders, as it points out in this in the review in the paper, are oftentimes will kids will begin experiencing tic disorders anywhere between the ages of 3 and 10. That's the most common times. They can oftentimes be either focalized or more complex, where they're involving many different muscle groups. And if they last for over a year, they're considered to be chronic in nature. The typical medical approach for treating tic disorders would be behavioral therapies, and behavioral therapies help teach kids coping mechanisms so that they have a way of trying to reel in the tics, basically, or suppress them for longer periods of time. But as many parents and kids will tell you, they can learn those behaviors or learn the ability to reel those in, but it takes a tremendous amount of energy to do that, and oftentimes by the end of the day or during stressful situations, those tics will kind of re-show up or re-express themselves. There are some medications that are also used to treat tic disorders, but again, they don't get to the root cause of the tic disorder. What they're doing is helping to relieve the symptoms within these kids. And some of them do have pretty powerful side effects as well. So what makes this paper a little bit different? Well, it's showing that by getting the neck adjusted and by normalizing the information that comes from the upper part of the spine into the brain, you can really start to drastically improve the functioning of the nervous system, which is primarily where tic disorders are coming from. They're neurologically based disorders that are showing some type of malfunction or disturbance within the central nervous system that's showing up in these disorders. So in the paper we talked that we're talking about, this kid received chiropractic care for 7 months. Received a handful of adjustments. The tic disorder completely resolved, and after a 1-year follow-up, remained gone. So that's great to know that, because as soon as the neurology straightened itself out and the body had a chance to resolve that situation and heal, not only did the tics go away, but neurologically his brain basically reprogrammed itself, and he was allowed to live without the tics and not have to try to control them through behavioral therapy or medication use, which is great for that child. So I hope that you enjoyed the review. If you have any questions, by all means, as always, give me a phone call at the number listed here on the video. You can Facebook us, you can send us an email, whatever's convenient. We're here to help. Excuse me, and if you have any other further questions, by all means, don't hesitate. Have a great day. Take care.